Struggling with morning sickness? Today we're going to go over all of the things you can do to help manage your first trimester nausea. My name is Jess. I'm a certified nurse midwife and infertility mom, and right now I am 9 weeks pregnant after a frozen embryo transfer. I started having a lot of nausea around 6 weeks of pregnancy, and it has just been progressively getting worse. Today has been pretty rough, so I'm in bed in my jammies again. I'm also just having a lot of fatigue and pregnancy eczema. I don't know if you guys can see it. It's super cute. Anyway, it's pretty misleading that we refer to pregnancy nausea as morning sickness because for a lot of women, it lasts all day long. For me, it gets progressively worse throughout the day and usually it peaks in the afternoon. Fortunately, I know all of the tips and tricks since I share them with my patients all of the time. So my first recommendation for pregnancy nausea is to take vitamin B6. You can get this over the counter in 25 milligram tablets and you can take it 6 to 8 times throughout your day with a maximum dosage of 200 milligrams in a day. If swallowing a pill triggers your nausea, then you can get vitamin B6 in the form of lozenges. I usually get Preggie Pops Plus. There's just sour candy lozenges. They're lemon and raspberry, and they've got the vitamin B6 added, but you want to make sure you get the ones that say plus because regular Preggie Pops don't have vitamin B6 in them. I do have an affiliate link in the description for the correct ones. You can also pair this with an over-the-counter medication called Unisom, which is a sleep aid that is well studied in pregnancy. Because it's a sleep aid, you may not want to take it during the day, but I do have a few patients who find that it helps their nausea so much, the Unisom combined with the B6, that they take it all day anyway. These are actually the two active ingredients in the prescription medication Diclegis, which is a medication that's just for morning sickness, but it's again literally just vitamin B6 and Unisom. Because there's no generic, I find insurance frequently will not cover a prescription for Diclegis. So for my patients that want it, I just instruct them how to make their own at home with the B6 and the Unisom. And because this is well studied in pregnancy, I feel safe recommending this to my patients. Obviously, if you have questions or concerns, you should talk to your healthcare provider about it. My second tip is to eat smaller portions more frequently. A lot of women are going to get more nauseated if their stomach is empty. It can be good to keep crackers on hand, especially if you're nauseated first thing in the morning. Keep crackers on your nightstand so you can eat a few before you get out of bed. I usually keep crackers stashed all around the house and in my desk at work, and I find it makes the biggest difference. If I'm getting really nauseous, I can eat like 2 or 3 crackers and I'll feel a lot better. Speaking of crackers, my third tip is just to eat what sounds good right now. And it is okay if that food is minimally nutritious, super bland, super carby, like crackers, ramen noodles, pasta, that kind of stuff. A lot of women will develop an aversion to veggies in the first trimester, and this is totally normal. It's thought to be a protective mechanism from our hunter-gatherer days, so we didn't accidentally eat plants that were poisonous or harmful to us. A lot of women will also develop an aversion to the smell of meat cooking, and this is a new one for me. I've never had this in any of my other pregnancies, but just a couple days ago, my husband was grilling burgers, and the burgers tasted delicious, but the smell of the burgers cooking really put me off. Do not beat yourself up if you are not eating super healthy in early pregnancy. Fortunately, your baby is teeny tiny, itty bitty right now, and most of the time they can get the nutrients they need as long as you're not starting out pregnancy underweight. I encourage my patients to eat what they can in the first trimester and focus on eating more nutritious once they feel better. Sometimes I do have patients that feel really nauseated their entire pregnancy, and even if they lose weight, I find most of the time they still have healthy, normal 7 to 8 pound sized babies. My fourth tip is eating peppermint and ginger candies. Peppermint and ginger teas are okay as well, but you want to be careful with ginger tea because a lot of time it will be lemon and ginger, and you want to read the label closely to make sure that there's no lemongrass in your tea because that is associated with birth defects. In theory, small quantities are safe. Personally, I don't think it's worth the risk. When I was pregnant with my daughter, I found just like ginger hard candies really helpful. This pregnancy, ginger sounds disgusting to me, but I am finding all of the leftover candy canes from Christmas very helpful. Number 5, you may want to consider switching out your prenatal vitamin. If you're trying to choke down one of those giant horse pill vitamins and you're having a lot of nausea, you may be better off switching to a gummy vitamin for a while until your nausea resolves. Obviously, your prenatal vitamin is not going to do you any good if you throw up right after you take it. Some women will also swap out their prenatal vitamin for just a folic acid or a folate supplement, which is the most important ingredient in your prenatal vitamin, and that's actually what makes your prenatal vitamin a prenatal vitamin. You may also want to check if your prenatal vitamin has iron in it. I find a lot of women think they need to be taking extra iron in the first trimester, but we routinely check hemoglobin and hematocrit levels in our patients, and I find most of the time they don't actually need iron until later in pregnancy, and iron can definitely upset your stomach more. Again, obviously, check with your healthcare provider if that's something you need. Next on my list are acupressure bands, also called C-bands. There's these little bracelets with this hard dot. I don't know if you can see how pronounced that is, that they're pretty tight and you wear them on your wrist. I'll put them on to show you. And for some reason that acupressure seems to help nausea. So I just put them on with that hard dot towards the middle of my wrist, a little ways down. And it's the silliest thing, but it has actually made a huge difference for me with this pregnancy. They can be pretty hit or miss. I have some patients that swear by them. Other patients tell me they didn't feel like they did anything, but I got these ones for just $5 off of Amazon. Again, I'll drop an affiliate link in the description. So it's not super expensive if it's something you just want to try. I didn't try these when I was pregnant with my daughter, and I only got these ones about a week ago, but I have found that they make a really big difference those times when I'm really struggling to get through the day, especially like in the afternoon after lunch. However, I find I can only wear them for about 2 to 3 hours. Otherwise, this part of my hand starts to feel really bruised and tender. And fortunately, as soon as I take them off, it doesn't feel tender anymore, but I don't keep them on for very long. Last but not least, if these options don't work for you, there are prescription medications you can try, most commonly Phenergan and ondansetron, which is also known as Zofran. If you're interested in trying these options, you should discuss risks versus benefits with your healthcare provider. Phenergan can cause significant sleepiness, so for my patients that want to try it, I usually recommend that they try it at bedtime first. The nice thing about Phenergan, though, is that if you can't swallow a pill, it also comes in a rectal suppository. Maybe not such a nice thing, but if you can't swallow a pill, it definitely works. Zofran is a tiny little pill that you dissolve underneath your tongue, so again, you don't have to swallow a pill. However, the catch with Zofran is that it can make you really constipated. So my patients that elect to use this option, I tell them take the absolute minimum amount that you need, because most women struggle with constipation in the first trimester anyway. I hope you found this video helpful. If you have other nausea tips and tricks, please drop them in the comments. I post new videos every week about infertility, pregnancy loss, pregnancy now, and my own IVF journey. So please like, subscribe, and turn on the notification bell so you don't miss an upload. Thank you so much for watching.